Let's be honest, we've all been there. Trying to get a simple prescription filled can feel, well, anything but simple. It can be this whole maze of phone calls, trips to the pharmacy, and just plain confusion over costs. It's a huge point of friction in healthcare. But what if it didn't have to be? Today, we're going to dig into a company called Caducian, which thinks it has cracked the code.
A seamless solution. In an industry that feels like it's defined by complexity, that is a really bold statement. It's basically saying that the tangled mess of communication between you, your doctor, and your pharmacy isn't just a little annoyance. It's a fundamental problem that's ready to be solved.
And that really is the heart of the problem, isn't it? The journey itself. Think about it. The moment your doctor writes that script, the ball is pretty much entirely in your court. Now, it's on you to find the right pharmacy, figure out the pricing, manage the refills. It's not just inconvenient, it creates this whole chain reaction of frustration that hits everyone: patients, doctors, even hospitals.
And that leads to the big question, the one that really changes everything. What if you could just untangle that knot? What if there was a straight line, a direct, simple path from the doctor's decision to the medicine arriving in your hand? Well, that's exactly the challenge this company, Caducian, is trying to tackle.
So the proposed answer to that question is Caducian, and they're trying to position themselves as something more than just another healthcare app. The idea here is a total rethink of how prescriptions are supposed to work, from the ground up.
Okay, so what is Caducian exactly? Well, at its core, the official definition is a patient-centric healthcare application. And that key word right there, patient-centric, that's everything. It signals a major shift in focus. Instead of making the patient navigate a difficult system, the goal is to build the entire process around the patient's actual needs.
And here's the big promise, the real value. It goes beyond just making things easier. The claim is that it delivers tangible, real-world benefits, saving people both time and money. And crucially, they're not just talking about patients. The idea is that these savings ripple out to everyone involved in the process.
All right, so this is where the story gets really interesting. If they say everyone wins, who exactly is everyone? Let's break down all the different people and groups who could actually benefit if this whole prescription process got a lot smoother.
And when you look at the list, it's surprisingly broad. Of course you've got patients and doctors at the center of it all, but it doesn't stop there. We're also talking about hospitals and clinics and even companies, specifically their HR departments, and universities and schools. It's designed to be this connective piece for the whole healthcare ecosystem. Now, trying to solve every problem for every person right out of the gate is usually a recipe for disaster. And it seems like Caducian gets that. They're taking a much more strategic approach, starting by focusing their efforts on a few really key medical areas first. So they're zeroing in on specialties where managing medication is absolutely critical. We're talking about pulmonology, cardiology, endocrinology, with a special focus on diabetes, and orthopedics. The plan, from what we can see, is to really nail it in these areas and then expand out into more specialties over time. Okay, so let's pull all these threads together. We've talked about the problem, we've looked at the solution they're proposing, and we've seen who it's for. Now let's look at the big picture. How does this reimagined cycle actually create that win-win situation they keep talking about?
So this is the big idea, right? A kind of positive feedback loop where everybody comes out ahead. The whole argument rests on this idea that if you solve the patient's main problem, it creates this ripple effect of good things for everyone else. But how does it actually work? How does a patient saving a few bucks or a few hours actually help a doctor or a company's HR team? Well, here's how all those dots connect. For us, the patients, it solves that huge headache of just getting the prescription, which saves us time and money. Simple enough. For doctors, who often worry about whether their patients are actually taking their medicine, the benefit is huge. Better medication adherence, which leads to better health outcomes. And then for HR departments, it suddenly becomes a cool, modern, and really practical perk they can offer to stay competitive. You can see how it's a clear chain reaction of value.
So when you boil it all down, the idea is that by fixing one of the most common, universal frustrations in the system, the simple act of getting a prescription, you might just create positive change across the board. And that leaves us with a pretty big question to think about. Could fixing this one seemingly small process actually be a key to healing some of the bigger problems in healthcare itself? Thanks for diving into this with me.